distinguished colleagues, fellows of Pharmaceutical Society of Nigeria here present, the past president here, elders of the profession, past national chairman, BOF chairman, distinguished NEC. I want all the schools to come up, please, as we do this our presentation. I want in a special way to thank all the various committees that have presented their reports or what they have done for the past 1 year to assume office. I wanted to use this initiative to show us that we are all working together, and whatever we are achieving or whatever we are going to achieve is not only the National Executive Committee or NEC. We are working in collaboration with all of us. And it is only in that unity, in that spirit of collaboration, we can achieve what we expected to achieve. And on that note, I want to present our strategic plan, which comprises all the committee members. And that is what I'm presenting today. First of all, as a leader with my team, we need to understand and have a vision of what we want to do or how we want to lead. And I said to be the best pharmacy association that foster professional and economic satisfaction for our members, thereby making community pharmacy the cornerstone and the hub of accessible and affordable quality health care for all Nigeria. Remember, our slogan says, empowering community pharmacies and protecting our people. We must understand that as we lead. And what are our mission? To be committed to fostering innovation, professional excellence, sustainable pharmacy practice amongst Nigerian community pharmacies, while advocating for policies that enhance the role of community practice in primary health care and thereby creating sufficient value for all the stakeholders. It's very, very important that we cannot do something alone. And if you have a vision, you must have a mission. A mission is just the means you'll be able to achieve your goal. And a vision, you set goal. On our strategic plan, that's how we are presenting this. And before we start, when we assume office, you should be able to know where we are then and where we are going. And we did a SWOT analysis. And in SWOT analysis, you should be able to assess some certain things, some certain key parameters. And I say the strengths, the weaknesses, the opportunity, and the threats. And we know it. That is very, very important if you do SWOT analysis. In our strength, we're experienced leadership, and we all of us, both at the state and the national level, I believe you are elected, you should be experienced, you'll be able to know, yes, you know the culture of the profession, you understand the profession, you understand what you are going to, you have all what it takes to be a leader. Expertise and professionalism, which all of us will know is a strength to have. Potentials. We have over more than 6,000, and we have more than 8,000 community pharmacies that in our national portal. It's a big strength. We can do wonders. We have also legal backing. We have our PCN Act 2022 that have empowered us to do a lot of things. And I know law and ethics have dwelled on that. We plan that we are going to synthesize those areas that are very, very important for community pharmacy. I think before the next conference, you'll be able to have handy a synthesized, a summarized aspect of our pharmacy act so that you'll be able to, protect yourself from any embarrassment from an NAFDAC, PCN, police, or whatever. Integrity, policy, current administration. Integrity is the key. Is one of the things people in the society represent us. When we talk about weaknesses, you see limited spread across Nigeria. Yes, we know there's a lot of areas in this country we don't have community pharmacy. We know that. And also a stereotype of our mindset. There's a way we reason, there's a way community pharmacists, listen. So we need to change our orientation. Is a kind of what? Weakness we are facing. Resources constraint, yes, people complain about no financial muscles to start their business. Attitude to professional development and skill acquisition. Most of us don't like to go into training or even furthering your education to acquire a lot of skills. Is a very, very weakness of it. Dissatisfaction with financial denomination, yes. A lot of us do things free of charge. Government are not concerned about what we are the impact we are creating. A lot of opportunity in the trade. You can also see over-regulation. People say it much. That was why we are bombarding NAFDAC, PCN, and all that, because over-regulation is a threat. Chaotic drug distribution, which all of us know. And I believe the federal government is looking into that. If we're able to achieve this CWC, and as a mega drug distribution centers, wholesalers, retail, and all that. And as a connection between the distribution chain, where from the from connected wholesalers to connected wholesale centers to wholesalers, from wholesalers to retailers and all that, our distribution system will be okay. Economic crunches, we know that is a very big exodus of multinational companies and all the product scarcity and all that. We know is a threat in our practice. Interprofessional rivalry, we know that. Doctors don't want us to exist. Nurses, lab scientists and all that. All of us will take towards collaborative aspect. Opportunity, as I said, also, you see health insurance. Health insurance is a major key now. Especially those in Lagos that are benefiting health insurance as I speak. I know about 2 patients have accessed my facility, and I was able to dispense those medications as I organized this conference, as well as participating in this conference. So health insurance is the key, and that is what we are advocating, that other states should employ. That vaccination, we also, participating in that. Primary health care is another areas of opportunity. Entrepreneurial preparation. Most of us are not into it, but I know there's a community pharmacy in Lagos that are making a lot of cash in this aspect. Financing, yes, financing opportunities are there. The Bank of Industry, they are now trying to offer loan facility for community pharmacy at the 9% interest rate. There's a link I will share. If you fill the form, they will call you and ask you the requirements you're supposed to do. Somebody share it with me. There's all that financial institution apart from bank, like Tilit, Nucleus, and all that. These are the opportunities we are having. You can get finance to empower your business at lower percent. So these are the opportunities we have seen so far. SWOT analysis. After doing that, we now say, what are our action plan? Position community pharmacy for health insurance provision. I encourage us to do that. I encourage us to work towards that. Especially in Lagos State, we still need more people to enroll. We have only 300 community pharmacies that enroll in that insurance scheme. While we are more than 2,000 community pharmacies in Lagos, where are others? And you can make money in that aspect. Take advantage of funding from banks to improve the business plans. And before you do that, you should be able to have that integrity that you are going to pay, that if you accept this fund, you'll be able to do that. Support community pharmacy through needs assessment and training program, which all of us, what we are doing today. We do training just like our people have done, research training, other trainings we do to empower us. UTC training, that is a treatment curriculum, universal treatment curriculum we do on vaccination and other things. These are the things we do. We do personal analysis. In personal analysis, as a leader, you consider a lot of things. Political, legal, as is stated there, social, technology, and that. In political, government policies encourage exodus of most of the multinational. We know that. It's because of government policy. resulting to scarcity of key products, which we know what we face when there is scarcity of most of the emergency drugs like Ventoline, Augmentin, and other things. We know what it causes. Poor regulation is another key. Political will, does they have that political will to maintain this regulation? Tax reform. Recent tax reform favor community pharmacy, but many operators are unaware. So, and the uniform, these are the things all of us need to also know and what we discuss towards political reform. Lack of political way to shut down open drug markets, I've said that, is a very, very sustaining counterfeit drugs. But I believe if they should continue in the way they started now, I believe we'll have opportunity to handle that. Economic, high inflation rates as of December 2024, it was about 30%. It's high, and also that thing affected our what? Affected the price of drug and reduced your income intake. Unstable forex market, we know that when the dollar is so high, what you do, electricity tariff increases increments. We are suffering so much because of that, and that was why we encourage embarking on what? On solar system, and most of us are doing that, but they are not seeing the opportunity of doing that. High lending rates, obtained it, low disposable income. These are economic challenges we are having. We want to talk about social, public misconception. Many Nigerians cannot distinguish between realities and artificial. Some say vendors, chemists, PPMV and all that, they call all of us doctors. We don't know what we should be able to distinguish ourselves. Public health, mates on vaccination, just like during COVID, a lot of people refuses to take the jab because of misconception. Especially in my family, I was the only person that I took. My wife said he doesn't want to take. They are waiting for when people will, and many other people as well. So these are another things we analyze. Cultural preference. Most people are going to Harvard now. When you are giving them orthodox medicine, they will tell you no, that the traditional medicine work more better than that. What about technology? The lives of e-pharmacy is very, very key. Whether you like it or not, you must key. In the next few years, if you are not technological prone, you will not be able to achieve more. Point of care testing, bank transfer, reliance, and all that. Cyber cafe, risk, AI and automation, and all that. So these are the very, very important. These are the key things that are known, which we must key on. I remember when past years, if you're in conferences like this, the people will be calling you, confirm alert, do this one, and all that. The alert you are confirming is not even better money. It may be a alert of paracetamol of 150, and they call you. But technology have taken up all those things. And those people, our assistants, pharmacy assistant, and all those at the work can confirm that now. AI is the key. Most people now, if we consult you in your premises and you ask AI any case, any disease case, it can give you information as regards to any disease challenges. You'll be able to make your subjective judgment using SOAP method, subjective, objective, assessment and plan. You'll be able to do what? To handle your patients. Then environment, disease outbreak, poor sanitation and public health education, increased disease burden, poor porosity, weak control allow entering of counterfeit and substandard drugs, climate impact, rising temperatures and humidity can affect drug storage and shelf life, increasing inventory and management costs. We know those things are also a challenges as we do. I don't want to waste much. And regular PCN Act 2020 provide legal backing for pharmacy practice and aim to curb unqualified entries. That was why I was telling PCN here yesterday that it is very, very simple. You cannot unseal or seal a place. Within 1 week or 2 weeks, you unseal the place. You take the premises, give us the status of these premises. Give us the status. If you know you are not the one backing these premises, we'll be able to go to the court and sue the premises. And if the court sue, seal that place, it is only court that can unseal it as well. NAFDAC and policy rates, we've discussed about it so much here. We'll talk about ticketing. We'll talk about when you come, use a pharmacy to come to the community pharmacy for reading. Make it very mild. You don't need to come with enforcement agencies and police and all that, and our act as if to say you have committed crime. If you enter quietly with a pharmacist and they find anything that is not obtainable by the law, and they ticket you and advise on what to do, and caution you as a pharmacist to go and do that. Poor legal awareness. Most of us don't know our laws. We don't know what we can do and what we cannot do because we don't read, we don't ask questions, we don't do research. You don't expect local government person to come into your facility and begin to ask about rent rate, begin to ask about you, radio and TV, and ask all those small, some payments, multiple tasks they do. But if you know your pharmacy law and you are under federal government exclusive risk, and you state it to that local government personnel, at times within that statement you make will tell them this person know what he's doing, and they will go. So personal analysis with it, action plan, legal assembly bulletin for members, just as I said. Pharmacy Act, the Law and Ethics Committee is going to provide a summary of this, our Pharmacy Act, that will share to members wherever you are, whether you are in Bayelsa, in Kano, or whatever, where any state you are, you'll be able to know what you do. You know, we need to partner to recruitment agency. We need to do PR campaign to reduce CP identity, IT training, end-to-end tech solution and all that. It's just what we are doing now. We need to equip ourselves based on this so that we'll be able to know where we are doing. What are our core values? Our core values are very, very important because integrity is the key. Credible integrity, credible relationship is very important as a pharmacist, and people respect you for that. Then that is why I'm talking about commitment to ethical standard with zero tolerance for what? Malpractice. Just like what somebody said was asking question 2 days ago. You can't, as a pharmacist, in community pharmacies, you have where you set lines, give infusion into your premises. It is not obtainable. There are some certain things you must know that you must do, and the one you cannot do. You build on that integrity and trust, people will respect you. Accountability and transparency to achieve a goal. Very, very important as well. Adaptability, flexible approach to evolving practice. Effective collaboration with stakeholders, very important. Continuous improvement, dedication to constant progress in the field. Innovation, exploring new ways for efficiency and satisfaction. Those are the core values we feel that is very, very important for us to succeed in this our regime. So who are our customers? Who are customers? We decide to say, let us know who is our customers. We are talking about community pharmacies. Community pharmacies who are leading. A professional, healthcare professional in a community pharmacy responsible for medication safety, public health and care, registered with PCN, work full-time or part-time. Roles include dispensing, counseling, advocacy, inventory management. This is who we are. We should be able to understand ourselves and know who we are and what we can do at the time. But I say there's a dual role of community pharmacy. The way I understand it, there are people that are science, clinical inclined. They like of veterinary drugs. Most people, they like of Newton pharmacists will be the people that do core clinical practice. They focus on sustainable evidence-based practice. That is why we talk about research. That's why we talk about constitute that drug information center and research. So that when you are doing that, you'll be able to give us reports, be able to give us data and all that. Then other aspect of pharmacy is business inclined. Business inclined, what are their rules or what they focus on that? Business inclined persons they need financial freedom to do their business. Money to stock. They talk about profitability, diversification of service, market adaptation, regulatory compliance, very, very key. That was why we choose that topic on regulatory landscape, so that people will be able to understand the requirement either from council or from NADAC, so it will reduce all those core, confusion and all that we normally have. Should be able to understand that. So these are what the people need. And we have provided avenue for that. That's why all those financial institutions, you can access money. Clinic-oriented, we need what? Inventory, database. It's very, very important. Regulatory updates, staff training and retraining, workforce accessibility, affordability, all those technology use, friendly tech tools, cost-effective financing. Most of us, if you want to indulge into tech in a facility, you cannot do it alone. You must employ staff. You must employ staff. That's why in most pharma companies, they have department, IT department, and they are working there. If you go to bank, they have IT department. You engage 1 or 2 persons to do the data generation for you. If you don't do it in your facility, you cannot produce any data. You can't do it alone. What I did when I engaged 2 persons as a digital staff, they are there to generate data for me. Since I started my community pharmacist, I told them, I brought out my notes and say, pick all the names, generate all the names, put it in the system and all that. And whenever I want to see any of my clients, it's my system. I have more than 8,000 clients I have seen since I started my pharmacy in 2009. And it's there. And they feel happy when you come. And I press my system and say, okay, when last did you come here? The person will say, I can't know, I don't see this. Okay, this is your name. And turn it and see your face, I capture through herself. Most of people who do conferences will come here, will listen, will do everything, will don't practicalize that. And the person will feel more confidence. By the time I tell him my discussion with him, when he came, maybe 2 years ago or 1 year ago, and I said, this is what we discussed, and this is what I gave you, and what is your problem. So, but I can't do it alone if you don't engage a staff to do those things. This is why it is very, very important. And if you don't generate data, data is money now. I've said it time without number. Aquiver is a company that are generating data. They come to my facility, pick data quarterly, pay 50,000 my head office, my second office, the 50,000, 100,000. It's the money that comes from nowhere, I don't know. They just come and open my system and pick a data. And I have those things that can help us. So data is money now. And also data is what we can use to make a statement. When we get in a stakeholders meeting, when we're in precision policy, and I was saying what community pharmacists can do. I was laughing. I told them, I stood up and told them, it's high time you people don't know what community pharmacy is all about now. We are gone beyond drug orientation, more or less to clinical orientation now. Patient oriented. And I can tell you vividly, I have over 4,000 clients in my system. And I changed my phone and turned it to the chairman of the precision committee. See it, what do I do? You should high time you begin to appreciate what we do. And I mentioned about private clinic, about Elikon Hospital, Sanusi Hospital, in Olodia Papa. I refer my patients, even the gynecologists there that are there. I refer my patients. And in absence of that, we can, if I don't have the data, I won't be able to make a statement. So data is very, very important. When I told them that when council and in the e-pharmacy program, the people that presented, was it yesterday? I was not there. They were talking about e-pharmacy, how do I aggregate people and all that. I said we have almost 8,000 members in our portal. We have aggregator platform. We have brought them together now. That you're already on board. You are already aggregated. What you need, your data, every other thing, your information, your pharmacy, your name is there. That's why when we send a message, we send a personalized message that can call your pharmacy name, call you as a pharmacist, send your address and all that. We have aggregated our platform. Anywhere federal government wants us to do. If they want to give me identification number, we'll only key in, give a command to the system. It will give all of us a number and we'll key into a system. So whatever we are doing, community pharmacy, see it. Clinical orientation, these are how to, I've talked about this. Clinical oriented, okay, access to this. We have tools that will can help us. Other area of specialization as a clinical oriented community pharmacy. We can do like a specialized practice like pediatrics, mental health, digital health, telepharmacy and all that. In Anambra now, they have started telepharmacy. And we are still thinking whether we can do it. What is telepharmacy? Where you can use your hours up here, communicate with person and prescribe drug, and other things you can do. Wellness and nutrition service, people are already doing that. It's an opportunity. Chronic disease management, these are opportunity in that. Medication therapy management, these are diseases on that. Healthcare, immunization, these are what stop us from say yes, I want to be a custodian of what? Drug. You go to television, you go to media, you talk about vitamin C alone as a drug. Tell us what the mechanism of action. Tell us what's the pharmacokinetic principle, pharmacodynamics, some of the as a topic. Those are the things that can distinguish you. People say, talk about fragile alone, metronidazole. Talk about any drug you pick and specialize on that. Those are the things that can distinguish you in the community, and people want to respect you. Blending, loyalty program, and all point of care testing, we are doing consultation and all that we are doing already. Business opportunity ACPN. Tell us services to CPN needs using bottom-up approach, value creation justified, charging for service, win-win for ACPN and community pharmacy practice. Most of us think you don't charge, you don't do consultation. I don't do it. I consult, and they pay me for that. I have my card, which I saw from ACPN when I become a member in other conference planning committee. And I say a card produced by ACPN, our past leaders. I pick that card, develop my own card, add one or two things. Before you come to my facility, you must pick that card. Before you see me, you must come in with your card. And I charge you 2,000. For the whole year, 2,000 for that card. The card I use like 15 naira to produce. That was then. And when you come in, you are checking your vital sign. You are checking all the vital signs. That is what we do. Non-communicable diseases and all that. And you pay. Pay your consultation fee and do value-based care. People, personalized care, we are talking. And people will pay you for that. We don't say we are not charging because we didn't go to school. We didn't spend money in our school. Summary of what I'm saying and all the things we are doing here is that just for all of us as a community pharmacist and member to implement, have a strategy that will give you a result. Implementing strategic direction align with our vision. Strategy that will align with our vision. We must empower ourselves and we must protect the people. Empower members through training and support. That's what we are doing. Create sustainable value for stakeholders. Stakeholders engagement is very, very important. The other stride, why I want to show us where all of us is working, all the committee members, and what your responsibility and what you are doing, and most of the people that have done so well for this committee, and our strategic plan, our key indicators, monitoring and evaluation, our targets. We'll have a strategic plan from now to 2027 when we're handing over. Our strategic plan, we'll have our activities and we'll have 4-point agendas. And our 4-point agenda is to promote demand-driven professional development. We have done some research on that, and we know the activities we are going to do in this, and we have our timeline, and a timeline for first quarter, second quarter, 2025, 2026, 2027. And we have a responsible committee on this, and we have national chairman, and DIC, Charles, okay, committee 1, committee 2. All these things have been fixed. All the committee work or what they have been fixed here. We have monitoring and evaluation. Monitoring and evaluation, we have key performance indicators that will tell us, yes, we are doing well on that. At the end of this conference, committee have presented the report. We'll be able to fix it in those tables. That strategic plan, yes, I can see it there. So you see that the responsible committees are there. It's not something I'll be able to read. Each of the key something we want to do, we have number 1, we have number 2, number 3. We have our responsible committee. We have key indicators, monitor and evaluation, and target in the next 3 years. That's why as a committee you work. I'm not doing it alone. So if you fail, we know that you have not done any work. We change the committee and bring all other person on board. But what I'm trying to do is to make sure that all of us work together. Because I know if you join hands, as we normally say, and what this is our key principle, if you join hands, we will achieve a better result. But you must be what? Be guided. That's why we have a strategic plan. That you have a directive where that is our responsibility to lead and direct and champion see a way where all of us can achieve results in the next 3 years. That is why whatever we are going to do by first quarter, second quarter, third quarter 2025, and then 26 is coming in, 27, and where we are handing over. We'll have all the responsible committees are there. So I thank you so much for this opportunity, and I thank all my committee for what they have done, all the standing committee for what I have done, and I also thank the NEC, because when I presented this to the NEC adopted this, and I know they will take it back to their state. We want a situation whereby when you are coming in as a leader, you should be able to have a plan. You should be able to have a budget. You should be able to have a direction you are going to tell your people. People will emulate from you. People will learn from you. And we'll all join hands. At the end, all of us will feel better and fine. And on that note, I want to appreciate, before I end this my presentation, the poster presentation that was conducted by some of our professors, a professor in UNN, a professor in UNIZIC. We found out that also collaboration with other technical arms of PSN is very, very important. It's not something you can do alone. You have every other person have area of strength, capacity, and all that. So they have done a good assessment. The research people have worked severally to produce groups that have different topics of research. And these are the things we continue to do, and the people who create impact in the society, and government will see, hear our voice always. So on that note, I want to appreciate the research committee for what they have done with a cash award, which we'll also discuss. We'll have the third position here is Samira Abubakar Omar Group. Yeah, your group, you got third position, and you got a cash prize of what? 50,000. To encourage you so that you get. The second runner up is Pharmacist Okeke Uche Chukwu. You have a cash prize of 100,000 naira. Then the first prize is Pharmacist Wemelu. I don't know whether it's the Igbo name, whether it's a joint name and all that. They have a cash prize of 150,000. Thank you very much, distinguished colleague.